notebook and he would teach us in his clinic. And Dr. Kamran would invite us, for the rounds in the morning. And even if the cases were interesting at times, he would ask us to present it and stuff. So it was so good, and it was around that time when we actually realized that cardiology is it. And the three of us felt it, and that's how actually CIG came into being. It's a vision, a platform for every medical student who feels the same as us and wants to pursue cardiology in the future. So what are our aims? We actually posted this one story, and we had a lot of questions and people asking us that CIG ka kaam kya hoga or kya goal hai? So CIG basically is the place for you if you want to network, if you want to connect with like-minded people who are interested in the same field as you. We have amazing patrons, wonderful opportunity to connect. Then the next thing, we have research, obviously. So everyone knows about research, everyone knows it's very important, and it's the one thing that makes your CV stand out. And CIG is actually introducing a mentorship-mentee program, and our research department actually will be talking about it today. We have planned a lot of sessions, very informative sessions, and Karthik will be talking about them at the end as well. I know you guys know about the surprise as well that we're going to be revealing at the end. I personally had so many people just coming up and asking about that big surprise. So we'll be revealing that at the end, and I'm very excited to share it too, but you guys are going to have to stick till the end. There is also community service project. So we have decided to also do community service projects, as a team, because it's good for you, and that way you can also give back to the community. Up until right now, in such a short time, CIG has achieved so much. We actually had our step 1 session last month. It was a guidance session, and it was a full house. We're so thankful for that overwhelming response, and I know most of you guys, you were actually there, but we actually have a very short glimpse of that session here, playing with us. Karthik is sitting. Okay. So that was our step 1 session. We actually were there at the open house as well, and I loved how we were able to connect with you guys, and we were able to interact and just talk about our plans, and just through that we actually crossed 500 signups, and it was great. So we love that. And the highlight of this event was actually Dr. Javed Suleiman, and he actually visited our stall and he loved our idea, so that was good. So here's the glimpse of that. So that was our open house, and now it's time to hear insights from our esteemed patrons. Our first speaker really needs no introduction at all. Professor Syed Zahid Jamal, MD, after completing his residency in US, did fellowship in electrophysiology from Harvard. He is the first ever Pakistani to introduce implantable defib here in Pakistan, Dr. Zahid Jamal.
Hello everybody, I'm so excited to be here. Once I was a student, of course not here. I mean, most of the time I spend at SMC because my friends like Javed Suleiman, you mentioned, and who worked hard to make this college as a university. He's my buddy, he's my best friend, and he's a cardiologist practicing, and he's all his heart for SMC. So good that you mentioned his name, it's very important. Now coming to the point here, when I think about it as a student in third and fourth year, I was not that much, I didn't know about my future. I only focused about my next exam, and which used to be at end of the year. So most of the time I was sitting outside the lecture hall, and I was mostly interested in politics and doing social activities what Rubab and Karthik and others are doing. I was more into it than into studying or going to the library. But I never used to go home by college bus. We stayed till the end of the day in the college. The only one thing I learned at that time when I was a student, I spent most of the time with my seniors. Okay, that was the key. They were final year, they were doing house job, so they were my buddies, they were my friends. I was more close to my seniors. They guided me and they told me, why you are going to this lecture. I will tell you what the examiner will ask you in the, and I used to pass all the exam with excellent marks because of the guidance of the seniors. Nowadays I see the friends and colleagues, they don't have communication, they don't have interaction with the seniors who are being successful, who achieve the goals. So you should, the key is the people who are ahead of you, like your, the SMC who are successful, who are doing their residency. Do you have such group in connection with the seniors, SMC alumni?
Yeah.
Okay, so that, I think that's the key part. So you won't waste, your class fellows are not going to guide you because they're learning stage, okay? They don't know what to expect. People have already passed MLE, who are successful. You should, and good Rubab has already created that group in third and fourth year. In US, most of the medical students, I'm talking about American, they will clear their MLE in part class, third year or fourth year, okay? But they don't get good marks, okay? But here, the people from the foreign graduates, they beated them in the basic knowledge because they studied for 2-3 years to pass this exam. But they could not get good score in clinical. So they changed what I think, because Americans could not compete with them because they're taking the exam in third year and fourth year. So they made it pass and fail now. Because when coming to merit, the foreign graduates will always get a high score. Now the difficult part is now, all the weightage is on the clinical now, okay? Where you people, you can't beat the Americans because as a third year, fourth year, they spend most of the time in the hospital. They work like a house officer, they work like as a doctor, okay? It's not like there's no lectures in third year, fourth year, final year. Like in AKU, they hardly get few lectures. Most of the students spend time in the clinics, seeing patients, and doing. So therefore, I think they've changed it. Now coming in, you're so much goal-oriented now. CIG is an important thing, of course. There's a new concept. I was just thinking about how come these guys are so smart. You're thinking now. I started thinking what I'm going to do after my house job. I didn't know where to go to UK for PLAB. I had FCPS book. I was preparing for MLE and also PLAB with 3 different friends, okay? Then and I didn't know what to do. Then finally one of my professor met me in one of the outside a ceremony somewhere. He said, I see you in every party and everywhere. What's your goal? Why you're still in this country? What are you doing now? I said, I'm preparing, but he said, it means you don't have any plan, you're not focused. Because I started earning money. So either you earn or you learn. Once you're getting a house job, I was doing 3 jobs. My pockets were full. I bought my own bicycle, motorcycle, and then I was so happy. I was earning, so I was not, I deviated from my goal. He told me either you earn or you learn. Then stop everything. Then prepared for MLE, and then I went US, and then I struggled. Good that I was the last one in my class to leave. Okay, most of my class fellows left after house job. After 3 years of house job being, I left. But I was the only one in my class who went to Harvard. Okay, so you're never late. What I'm trying to say, if your goal, if you hit, good that you're focused now. Now talking about you're already focused into cardiology, this is very good. This is good for if you're going to US, because if you apply there, if you see your CV, it's all lined up. You're doing research in one thing, and then, but to me it's little concerning because at this level it's too early to choose a specialty. I don't think this is the right time when you focus yourself just into cardiology, because you've not tasted everything. I mean, this is okay for few people who are very clear they want to be cardiologists. I was never sure until I did my residency in US. Then I decided, well, cardiology is a tough field. Everyone can get into. But if you have CVs like this from third year and fourth year and focus, you will easily get into cardiology. That's not an issue. So because it's a competitive field, but in third year, fourth year, you're focused doing research and you do your house job, residency, and you apply for cardiology, 90% chance they will get to cardiology. But my question is it the right time to decide that you want to go into cardiology? Here I have a problem, okay? Because the problem is you have to be a good doctor first, okay? I think the way I thought myself when I did every rotation like this. I wanted to do a specialty in that rotation. When I did endocrinology, I wanted to be a diabetologist. When I did rheumatology, I wanted to be a rheumatologist. I did oncology, I didn't want to be an oncologist. Okay? So you can't just focus, I want to cardiology. Then 90%, you cannot be a good doctor then. Okay? You can't think as a third year and fourth year level, I want to be a cardiologist. Yes, it should be in the back of your mind. What I would do differently, I would have my CV in mixed. Most of them will be cardiology, but I will have research in many other neurology, oncology. So when you apply in medicine first, you're not applying in cardiology fellowship, remember. You're applying in medicine, okay? If you want to do a neurology, if you have all the, from third year, you have no background in applying medicine or in other field, you will be loser. Because many of my friends, they could not get into medicine and they applied in psychiatry, they applied in neurology, okay? I know so many people. So you cannot have a CV just, I'm a cardiologist. You have, at this level, your CV should not be just focusing one thing. It may help you in some specialty, but first you have to get into the system. To get into the system, you have to mix bag. So you should be open yourself to neurology, pediatrics, because you don't know, because it's competitive to get into the system. You focus in just cardiology, you cannot apply in neurology, you cannot apply in pediatrics, you cannot apply in psychiatry. Okay, so first you have to get into the system. Majority of it can be in cardiology, but you have to, and that's the way I will think at your level, okay? It's too early just to focus, get into one subject, and you won't have interest in other fields. So this is a little distracting for me. Good that you have interest in it, you should do more of the research, you should have more of the interest in cardiology, but first you have to be a good doctor. To be a good doctor, you have to be a good internist first, then you can go into subspecialty. Cardiology is not medicine, okay? First you have to be a good physician, for which you should have interest in every field, okay? So don't, while doing your rotation, don't think you want to be a cardiologist and you don't do your rotation in neurology with interest. That will be a little distracting for you, all right? You have to pass the basic exam. In basic, every subject comes in. Then you pass the clinical exam. Cardiology may be 20%, 80% is the rest of the medicine. If you just focus in medicine, how are you going to get good marks in clinical side, okay? First, till final year, you should open yourself, should have an interest in every subject, and then after final year, when you're doing residency, then you can focus that yes, I want to do cardiology or oncology or hematology. There's so many interesting fields. Even in cardiology, there's so expansion now. You have invasive, we have sitting interventionists, we have electrophysiologists, Dr. Mohi. I did electrophysiology and also 1 year in intervention, which I did not complete 2 years because I had to come back. So I was partially trained in intervention and fully trained in EP. So now Dr. Sabha is here, she's trained fully in non-invasive. So many things, research, many people are doing public health. In the US, there's so many expansion now in heart failure, transplant, fellowship, heart failure fellowship, okay? So there are so many subspecialty which you can choose on. But first you're focused to be a good internist, okay? With interest in all the field, with background field in cardiology. So at this level, I think it's too early just to focus and label yourself. Cardiology interest group is good, is an excellent idea, but should not distract you from other specialty, otherwise you cannot be a good physician, okay? So that's the first message I want to give. The second thing is, of course, you're never late. The earlier you apply, the earlier you plan. This new generation I see is totally different than my generation. They know what to do. They've decided they want to be a cardiologist. This is very good, okay? I mean, and most of the people are very focused, they will achieve what they want. I know so many people, they want to be a surgeon, they only did interest in surgery, they get into surgery. I know one of my, I met a doctor from Ziadi Medical, his wife wanted to be a gynecologist. I said it's impossible to get into US. She did all her research in OBGYN, and he visited me he was just here in Ramzan, he visited me and told me his wife got into OBGYN. Okay? But it tells you if you focus from now, of course, it's more easier to achieve your career, to get in, because in US they like people who are not confused, who are very clear, and their CV supports their whole idea, and they love it, okay? But you cannot apply into psychiatry and you all your CV. I remember it was tough to get into medicine, so I applied in neurology. I applied in psychiatry. I was applied in pediatrics. It was more easier to get into than medicine at my time. When I remember when I did pediatric interview, they asked me, I had no background CV of pediatrics. He said, you did research in asthma, in methylcholine challenge test, in adult, the other field of pulmonary. What's your interest in pediatrics? You're applying. They knew that when I applied in psychiatry, they asked me what's your experience. Nothing, not a single paper to support. I did not do any rotation except my medical school. I could not. I knew. They just threw me out. So therefore I learned from that my CV was there, nothing there to support. So I should not even have applied in pediatrics. Okay, but I did. Luckily I got into medicine because I did 1 year research, free of cost. Okay, and I was just living. I even didn't know where the cafeteria is. I used to take my own sandwiches. I used to find where are the free conferences where I can get the pizza. Okay, so I used to attend all the free conferences, and I did 1 year research with one of the best professors. Because one of my senior person, I asked him, how can I get into the residency? It's so tough. He told me, why don't he helped me out in getting into research. And I did 1 year free research, and that person called for me before my interview that this guy is very good, he worked hard, and so I got in fellowship. So research is so important in your part. If you don't even have a good score, I didn't have one of the best scores, therefore I have to struggle a lot. I never studied as a medical student, as I told you. So even with bad marks, if you have good research experience background, you will get into the system. I think that's enough for now, and anything I'm here. Okay, all right. Good luck.
Thank you so much, Dr. Zahid, for sharing your insights with us. And now we have Dr. Kamran Ahmed Khan. After completing his FCPS and MCPS, he received specialized certification in interventional cardiology from Queen Elizabeth Dalhousie University, Canada. He's currently working as an interventional cardiologist at NICBT. Dr. Kamran.
First of all, thank you very much for inviting me in this such a good and exciting forum. And I mean, it's kind of a big surprise for me because I think I will start my conversation from the same where, Dr. Zahid Jamal has already pointed out to you guys. If I think about my situation at the level of your situation, so it was totally different. Probably, I think it was the effect of environment, or maybe maybe effect of government or what. I really don't know. But your enthusiasm, your interest and your excitement about your, pursuing future. It's really, appreciable. So I think a big hand for you guys, for yourself, for that. And second thing, because if you just look into the cardiology as a specialty or as your future, for example. So first thing first, you have to be a first good human being, and then followed by a good doctor, and then I mean like rest of the things will come afterwards. If you just look into the cardiology, so I think before embarking on decision of your future, I think the best idea would be if first you go through in all sort of situations, cardiology, gastroenterology, or whatever, and then you think later what is best for you and in which specialty you are actually suiting. So this is more important because the personal experiences for everyone is different. All individuals, because Allah has not made all individuals alike, right? We are all human beings, but we are all different from each other. So it's not like. And when I was doing my subspecialty, so it was the clear thing in my mind that before becoming a cardiologist, and more specifically before becoming an interventional cardiologist, you have to be a bit crazy. So how many of you are a bit crazy at this level? Just raise your hands. I think not more than 8 or 10 hands, right? And just for a cardiology, how many of you are interested? It's still less than 50%, I suppose. I think that the decision is clear now. So this is not the whole forum which is interested in that, but I think this is the best thing, and this is the wise thing that just go through it, have some interaction and experience, and then you decide about your future. Rest of the things I think they have been well explained by Dr. Zahid Jamal to you, how you have to pursue, how you have to go through your different scenarios in terms of your USMLE, lab, FCPS or whatever. But the good thing is that wherever you are, the bottom line is that you have to be an honest and sincere doctor or physician. Whatever you are, a surgeon or a physician, doesn't matter, but you have to be a kind of a sincere, so that you could have some ability or capacity that you can satisfy yourself. Because whenever, for example, if we are doing some intervention and we are in the intervention field, so what we think, we have to take our procedure until the point that we can satisfy ourselves, our heart. So this is our end. It's not like somebody, the people would think, how they think and how they will pursue and all that. If you are satisfied and you have given your all maximum, that means this is, you have done good job. So this is, I think, the things like that. I think, I don't think I need to speak more. If anything that you are interested and you are, willing just to talk to me about that, so I think this is free. If you have any question regarding cardiology interest or cardiology field, or especially the international cardiology, so I think I'm more welcome to have some questions. Okay, that's fine. Thank you.
Thank you so much, Dr. Kamran, for really guiding us. And now, last but not the least, I would like to call Dr. Abdul Mueed. After completing his FCPS and FESC, he's currently working as an assistant professor at NICVD. We're genuinely very thankful to you, Dr. Mueed, because you've been guiding us throughout and you've been telling us about social media and what exactly we should be doing. So we're very thankful. Dr. Abdul Mueed.
It's surprising to get too many people at this moment now. It's been a bit nostalgic moment as well for me. I'm here for around 15 years, after 15 years now. Okay? I'm SMC in 2008 back, and after 15 years I'm signing up. If you are joining cardiology, it's a marathon. ठीक है ना आसान नहीं होता, टाइम लगता है. 2008 में I cleared my MBBS, and 2018 I joined NICVD as a faculty. So in the meantime, the 8 years I was working as a resident. ठीक है ना? If you just, Dr. Kamran already said, अगर फील्ड के अंदर आना है, you have to be crazy. कमाओगे कुछ नहीं, ठीक है ना? बाद में जाके कमाओगे, उससे पहले कुछ नहीं होगा. एक दो चीज़ ये. दूसरी चीज़ ये कि Dr. Zahid and Dr. Kamran has already said about the research and all this kind of things. These are very important, and this is how the evolution happens. When we were at your age, we were not much aware of these kind of things. And at that moment, these kind of things not even important. ठीक है, तो काउंट भी नहीं करती, ठीक है, आप करती हैं, ठीक है ना, आप करती हैं तो यू नो यू शुड बी नोइंग हाउ द इवोल्यूशन हैपन एंड यू हैव टू नो हाउ टू मेक योर स्पेस, ठीक है ना, एक तो चीज़ ये होगी। दूसरी चीज़ ये, हाउ मेनी ऑफ यू वांट्स टू गो टू यूएस? सही है। हाउ मेनी ऑफ यू वांट्स टू गो टू यूके, आयरलैंड, ऑस्ट्रेलिया, ठीक है ना? Because wherever you go, the path is different, ठीक है ना? So you should be knowing where you have to utilize all your energies, ठीक है ना? Your enthusiasm is very good, but if it is not channelized, it will ruin your life, is to ruin your career. मैराथन रनिंग है ना, तो उससे पहले आपको सब कुछ पता होना चाहिए कि आपने रन कैसे करना है, ठीक है ना? अगर if you want to go to US at the level at your level at 30 years for 30 or 40, this is the time, just sit with your family, ठीक है ना? Issue is this, you people are not earning anything, ठीक है ना? आपका फाइनेंस कौन करेगा? आपके घर वाले, ठीक है ना? फैमिली सिचुएशंस क्या होंगी? एवरीवन हैज अ डिफरेंट फैमिली सिचुएशंस होगी। मुझे पता था मैंने बाहर नहीं जाना, ठीक है ना? आई हैव अ फैमिली टू टेक केयर ऑफ, मुझे पता है मैं बाहर नहीं जा सकता, अम्मी अब्बू के लिए पीछे कोई नहीं है, मुझे पता है। एवरी मेंबर हैज अ डिफरेंट फैमिली सिचुएशंस, तो उसको देखना पड़ेगा तुम लोग को, ठीक है ना? तो थर्ड ईयर फोर्थ ईयर इज द टाइम कि अपनी फैमिली के साथ बैठो एंड डिसाइड करो कि आपने करना क्या है, ठीक है ना? आपने जाना कहाँ है, सबसे पहले ये तो डिसाइड करो, पाकिस्तान में रहना है, यूएस जाना है, यूके जाना है, वेरेवर यू वांट टू गो, क्योंकि फाइनेंस को करेंगे, ठीक है ना? अपनी फैमिली सिचुएशन सारी होंगी, वो सारी चीजें डिसाइड करो इस टाइम, ठीक है ना? वंस यू हैव डिसाइडेड दिस, देन जस्ट फोकस ऑन योर एनर्जी एंड डू ऑल द थिंग्स दैट यू वांट टू डू, ठीक है ना? ये सारी चीजें होती हैं, इसको थोड़ा सा चैनलाइज कर लो, बहुत अच्छा हो जाएगा। दिस काइंड ऑफ ग्रुप्स आर वेरी इंपॉर्टेंट, वेरी न्यू फॉर मी, बट दिस नॉट मच न्यू फॉर द कंट्री एज वेल, ठीक है ना? बट यूटिलाइज योर एनर्जी इन अ प्रॉपर डायरेक्शन, ठीक है ना? और जब भी आप लोग करना हो, वी आर ऑलरेडी हियर, वी आर गोइंग टू डिस्कस, वी आर गोइंग टू हैव फ्यू मोर सेशंस, फ्यू मोर एकेडमिक सेशंस, तो उसमें फिर आपसे बैठूंगा, ठीक है जी?
Thank you, Dr. Abdul Mueed, and everybody please a great round of applause for our esteemed patrons. Okay, so guys, I will be now walking you guys through our departments and the structure and the compartments that make up CIG. So CIG is essentially divided up into 4 departments, and these 4 departments acts as our, you can say, a backbone, and essentially you can say that without them CIG cannot survive. So first up, we'll start with the logistics department. So logistics department is headed by our very own Muhammad Burhan Tariq. And honestly speaking, without Burhan, none of this would have been possible. So under the associates under Burhan are Muzaina, Neeraj, and Daniel. So in a nutshell, what is the job of logistics department? So if I have to explain it and condense it in a one sentence, I would say that logistics department is concerned with the smooth operating and the smooth running of the whole CIG. So logistics department is concerned with venue selection, efficient accommodation, and communication and outreach. And their job is to make sure that everything runs smoothly and everything is there on time, and there is no sort of any logistical issue there. So next up we have the marketing department. So you guys can clap if you want. Marketing or media department, I mean, it's pretty obvious what their job is. They're headed by Ilsakil and the associates are Amin, Fatma, and Aisha. So the job of marketing, so this whole wonderful outfit that we have, the whole hype behind CIG, the houseful that we have here, that's all to the untiring work of the marketing department. So marketing department is concerned with engagement, brand build, so the brand behind CIG, that we're selling, that if you want to become future cardiologists, and the hype behind that, it's all due to works of the marketing department. Then next up we have the academics department. So academics department, you can think of it as the brains behind the CIG. Now obviously we have mentioned before, and we're going to talk about it again, that we're going to have lots of seminars, workshops, and like tons of learning opportunities for you guys. And the content behind those is made by the academic department, headed by Isha and the associate Simon. The academic department makes sure that everything is up to the top notch, up to the mark, and authentic. And if I have to just condense the whole job of the academic departments in 2 words, I can say it's quality assurance. And rest assured, it's gonna be of top quality. So last but not least is the research department. So there's this hype behind research department that everybody wants to get into research. Everybody wants to increase their number of publications and whatnot. So research department is headed by Mirha, and the associates are Zainab, Reenal, Kaima, and Ali Abdullah. And I think it would be unfair if I explain the job of research department. So I think the best way for the research department to communicate with the research head. So Mirha, please just stay here.
Assalamu alaikum everyone, my name is Mira Ali and I am the director of the research department. So I firstly would like to share with you all the main aims and the future goals of the research department. So we're firstly planning to launch our first ever mentorship mentee program, and in this we're basically planning to select candidates based on the minimum research experience and knowledge. And the selected candidates will be further subdivided into 2 groups. One group will be working on a meta-analysis project, and the second group will be working on review articles, LCEs, and short communications. So this is how we planned the model of how to go ahead with our mentorship mentee program. Now, the main aim of this project is to encourage beginners to work and to gain experience working in a team and to apply their knowledge on research topics that we provide them. Secondly, through this we can also encourage and help them learn the step-by-step approach from topic selection to how a research paper is actually published. So this is one of our plans for our mentorship mentee program that we are aiming to conduct and launch this year. Secondly, we're planning to conduct our journal club sessions on a monthly basis, or maybe like after every 2 months we'll be conducting journal club sessions. We're planning to invite esteemed experts and research fellows who will be discussing their published articles that they have done, and our aim is to, through these discussion-based learning, we want our beginners and research beginners to actually know the basics in depth, and also to know what's the right approach of working of starting with a research topic. And last but not the least, one of the grand projects that we are thinking of conducting this year by collaborations with other societies is our first student-led research conference at JSMU. What's a research conference? Basically, a research conference is a platform for researchers to submit their abstracts which have not been published yet. And by submitting the abstracts, they can either present it through poster presentations or abstract presentations. So we're planning to expand this further, not just keep it limited to students of Jinnah. We want other medical students from other universities of Karachi to also apply in these poster presentations and abstract presentations so that we just want our event to be more large scale and more grand this year, inshallah. So now I would really like to share with all of you 2 very interesting research projects that the whole CIG team has been working very diligently for a very long time. One is a meta-analysis project, and the second one is a review article. So I'd like to dive and give an overview of both the topics that we're currently working on. First one is called Deep Learning-Based Cardiac Arrest Risk Management System versus Conventional Methods in Predicting the Mortality and Readmissions of Cardiac Arrest Patients, a Systematic Review and Meta-Analysis. So the main essence of this topic is that we want to compare 2 machine learning approaches. One is the deep learning method and the second one is the conventional method. So by comparing these 2, we can actually predict the chances of having adverse effects in cardiac arrest patients, eventually leading to earlier interventions of treatment and management, and hence, in the longer run, we can actually reduce the risk of mortality in cardiac arrest. So what is deep learning? Deep learning is basically an artificial intelligence. It's a built-in algorithm to predict trends and to predict trends and analysis. Basically, it helps us question the fact the integration between artificial intelligence and healthcare system is the integration of artificial intelligence posing more challenges, or is it actually more effective in the management of cardiac arrest patients? I'd like to give you an example. How can a healthcare system incorporate using deep learning methods? For example, a healthcare system can add patient data of cardiac arrest patients for the last 10 years into the system, and they can analyze the trends, and they can make like complex correlations between different aspects. For example, in one particular day, there are 10 patients who have come to the ER. Now, a healthcare system can actually see that which age group range, which gender is at a higher risk of cardiac arrest. So eventually, they can cater to that patient first. And through this, we can more accurately identify the patients who are at risk, eventually leading to a more timely intervention or rapid response. And hence, again, it can reduce the rate of mortality of cardiac arrest patients. And so basically, the whole aim of this project is to compare deep learning methods versus conventional methods. And yes, I'd like to emphasize that this is the first ever meta-analysis study that is being conducted incorporating a very large number of observational studies. And each study has around 55,000 patients. So overall, the collective sample size is very large. So eventually, after we conduct the subgroup analysis, after we enter the data of all the collective observation studies, our results and conclusion will be more reliable and more accurate. So we're really looking forward to the completion of this project. Hopefully, we're in the near stage of publication soon. Our next project is a review article called "Optimizing Cardiac Resynchronization Therapy Strategies for Improved Outcomes." So, what is cardiac resynchronization therapy? It's basically a treatment for heart failure. It induces electrical impulses through the heart chambers, eventually ensuring to regulation of rhythm and contractions of the heart. Now, something that is very interesting that really grabbed our attention for this topic was the techniques that come under CRT. One is a more conventional, older technique that's been used for decades. That's called the biventricular pacing system. Now, the biventricular pacing system, the leads are actually placed at three sites. One is the right atrium, one is the coronary sinus, and the third is the right ventricle. In comparison, the more newer and evolved and advanced system, which is the conduction pacing system, it's a more streamlined approach, and it has more advantages as it's simpler, more cost-effective, and it's more accurate. So basically, as the leads that are placed in the conduction pacing system, they're more at specific sites where the heart block has occurred, specifically at the his bundle branch site and the left bundle branch site. So basically, there has been this constant debate of which alternative, the biventricular pacing system or the conduction pacing system, is more effective in the management of heart failure patients. So we actually grabbed and identified this gap in literature, and we are aiming to extract data from 2022 to 2024 to analyze the trends and create this comparison between these two pacing systems eventually. Yes, so basically this is the main aim of our study, and we want to figure out which system has a greater left ventricular ejection fraction, which system has a greater QRS duration and left ventricular end systolic volume. So yes, this is the main vision that we have for both of our projects, and the main reason why we're sharing with all of you these projects, the reason why the CIG team is so vigorously working on both of these projects is to actually show to you that we are going to conduct more of these research projects in the future, and we want all of you, our future cardiologists, to be part of our research projects, which is why we really passionately working on these projects at the moment. So yes, that's about it from my side. I'd like to invite Karthik. Thank you.
Hello everybody. Hello. Thank you so much for coming again. So I know most of you guys are excited about the surprise. It's massive. ठीक है, It's something that has never happened in Pakistan. Like it has happened once before, but I'm pretty sure you guys are very excited about it. But before that, I think it is very important as CIG, like we need to tell you what are our future plans as in for this year. I think you guys should know okay, what you guys should be expecting from Team CIG. So I'll be very briefly sharing about our upcoming academic sessions, about our upcoming plans, what we have to offer for you. So our first academic session is gonna be very soon, and that's gonna be on ECG interpretation. ECG is something ke it's of course ये कि throughout the life you just keep looking at it, you keep studying it, and then ही आपको समझ आती है ज़ाहिर है. But till final year, most of us don't know what's the first thing to look for in the ECG, or what's the last thing, what's the process. So our goal with CIG and our goal with the academic session that will be on ECG interpretation is to make sure that you guys have basic foundation knowledge के what's the first thing. Okay, this is ECG in front of me, मुझे क्या देखना है, ठीक है? So that's gonna be our first academic session. उसके बाद we are planning to have sessions on ACLS protocols. Certified professionals like Dr. Abdul Moeed, he will be probably coming and teaching you, because ACLS and BLS certification is something that it gives you an enhanced CV, and we want to make sure that you guys have all the basic prerequisite knowledge before you apply for the certification, because it's extremely important and gives you a holistic CV. Uske baad, we have sessions on murmurs. Now, murmurs as a topic is something that really fascinates all of us. Like, कब कौन सा murmur कहाँ पे क्यों सुनाई देता है? This is something के even जो बात मतलब it's a lifelong, but आप सीख रहे होते हो, सुन रहे होते, and then we'll make sure that we have very creative session on that. We'll make sure that it's going to be extremely interactive in such a way that it's going to be hands-on. It won't be like traditional classroom session या YouTube पे आपकी वीडियो चला दी गया अच्छा ये AS का मरना ये AR का मरना. No, it's not going to be like that. We'll make sure that we are already in preparation, and we'll be creating this session in such a way that it's going to be very interactive and all. उसके बाद we are going to have again, as Rubab said in the previously, कि it's not just the sessions, it's not just the knowledge, and it's not just the research that gives your CV a holistic look. It's going to be volunteer activities, it's going to be community service projects, and this is what June is reserved for. June, all of us know it's going to be summer break, so we are already working very hard to plan kind of community service projects that we'll be taking on volunteers. We have amazing things planned up, honestly, and it will give you guys a real hands-on experience कि कैसे community service projects करने होते हैं, how to volunteer, कैसे करने and all. उसके बाद again, these are just the on-site sessions जो we have planned up. We have couple of online sessions as well coming up. Again, we had our step 1 session in Ramzan, and that was a massive success, and a lot of people came to us, they were sent back. So just to let you guys know that was not it. We are planning to have step 1 sessions, step 2 sessions, how to figure out electives in the US, because all of it is a very tedious process, right? So we'll be having online sessions on it, and we'll make sure that CIG is there to mentor you guys, to help you guys out at every step. Not only this, there were a couple of questions as we introduced the forms. There were a couple of questions on cardiothoracic surgery, because I'm pretty sure a lot of you guys are aspiring for cardiothoracic surgery, and a lot of you guys sent questions ke kya scope hai, what's the process, what's the pathway. So we want to again let you guys know that we are already in communication with top cardiothoracic surgeons, and they're going to be coming online and guiding every aspiring cardiothoracic surgeon, and they'll be basically mentoring you कि कैसे, what's the pathway, US जाना तो ये pathway, UK जाना तो ये pathway, if you're planning for FCPS तो ये pathway. There were a couple of questions that said is it just restricted to USMLE or is it just restricted to UK? And then there were like people who want to stay in Pakistan, of course, for whatever reasons. But point being this is a very, CIG as a platform is something it's gonna cover all the domains. So it's not just for USMLEs, it's not just for PLAB, Australia के लिए सिर्फ नहीं, it's gonna be covering everything. If you're planning again as FCPS, we have again young Dr. Abdul Moeed. He has completed his FCPS in cardiology, and again he'll be guiding you. He's very enthusiastic. He'll be guiding you for US, and then we have Dr. Zahid. So point being, we are covering every domains of it. उसके बाद जो ये कि again I'm sorry मैं लंबी कर रहा हूँ because I know you guys are waiting for the surprise, but yeah, there's this one thing that I wanted to tell. Okay, so I'm not spilling the tea puri, but we are already in, like, we have been approached by a couple of non-SMC societies, and they have massive plans, and they are already in communication with us, talking about the potential idea of carrying multi-center cross-sectional studies. Again, we are already in talks with them. We'll be updating you guys with it, but again, telling you multi-center cross-sectional studies is something that's massive. That's a massive achievement as a start for CIG, and we'll be making sure that all of you guys are involved in it. Like, as a learning experience, going to be a very collective learning experience. We're going to make sure that you have very मतलब किसी का टाइम ज़ाया नहीं होगा if you're coming for a session of CIG. I promise you that. And I think pretty much it. It's time for a surprise. Again, this is something that हमारी टीम को भी नहीं पता. It's just me, Ahmed, and Rubab who knows it. I'm too excited to announce this. So we'll be playing in. Yeah, media team, please make sure you guys record everything. We'll be playing an audio पहले, ठीक है? And then we'll ask you guys to guess. It's a pretty fairly obvious guess, वैसे. Guys, I'm playing it, okay? यार media team reaction दे देना सबका.
Okay, so we're gonna play this audio like now.
Yeah.
Play.
इशारा लगा जब मैं बोलूँ तो.
Hello everyone and welcome to our module on chest pain and dyspnea. Chest
Okay, so any guesses? Who is, of course, everybody of you knows. Yeah. So any guesses? क्या होने वाला है? Team CIG is hosting Dr. Jason Ryan next week for an online Zoom session, and that all of you guys will be a part of that session. You guys will be given a chance to ask questions to him. We'll be sending Google Forms very soon out, and think very out of the box. कोई ऐसे बहुत बेसिक सवाल नहीं पूछना कि स्टेप 1 कैसे पढ़ना है या ये कैसे पढ़ना है. वो बंदे ने सारा बता दिया कैसे पढ़ना है. But think very out of the box. Any 3 top question askers will get a chance to talk to him directly. This session is on Thursday, next Thursday, 9th May, 10 p.m. Pakistan time. Follow us on Instagram for all the updates. यार वो QR code लगा दो. Guys, please follow करो. Yeah, Dr. Jason, he needs no introduction. Founder, creator of BNB, a cardiologist at University of Connecticut. और क्या ही बोलूँ, सबने स्टेप बनने के देके पास किया है, मैं क्या बोलूँ. Yeah, so please follow us on Instagram for all the updates. Such last slide. Yeah. We'll be sending Zoom links on our. Yeah, we'll be sending Zoom link. अच्छा guys, सही है, surprise हो गया, सही हो. अच्छा, again, this is pretty much it for the orientation session. Again, actually want to thank all of you. This was an extremely overwhelming response. We were not expecting इतने सारे लोग. It would have been unfair अगर हम 40 लोग आपसे select करते for the CIG department. So we made sure we worked very hard to get this session, and it wouldn't have been possible without JSMU Student Council. So actually very thankful to them. I promise कि CIG के किसी भी सेशन में आपका कोई टाइम ज़ाया नहीं होगा. I'm very particular about it as well, personal level पे. तो I'll make sure कि किसी का कोई टाइम ज़ाया नहीं हो. Come to our sessions in the future. Attend our online things. It's gonna be worth it. It's gonna be very collective learning experience. Again, thank you so much. Thank you. या अभी जाना नहीं है. We are giving a token of appreciation to our patrons. So please don't go. Just stay with us for like next 5 to 10 minutes. Dr. Zahid, could you come on stage in like 1 minute? Kamran to just Dr. Abdul Malik.